Vitamin B6 plays a pivotal and often underappreciated role in one of the body's most critical cardiovascular defense systems, the regulation of homocysteine. Homocysteine is an amino acid that, in excess, becomes a highly reactive and damaging compound. Elevated homocysteine levels are strongly associated with increased risk of heart attack, stroke, arterial plaque buildup, and even cognitive decline. It acts like a slow-burning fuse for systemic inflammation and oxidative stress, damaging blood vessels from within and accelerating atherosclerosis. But here's the key: homocysteine doesn't rise on its own. It accumulates when the body lacks the necessary nutrients to convert it safely into benign or even beneficial compounds. And this is where vitamin B6 steps in, quietly but decisively. While B12 and folate often get the credit in homocysteine regulation, and they certainly play crucial roles, it is B6, in its active form pyridoxal 5-phosphate, PLP, that catalyzes one of the final and most essential steps in the pathway: the conversion of homocysteine into cystathionine and ultimately into cysteine. This transsulfuration process not only clears excess homocysteine but also produces cysteine, which is needed to synthesize glutathione, the body's most powerful endogenous antioxidant. In other words, B6 not only neutralizes a cardiovascular toxin, it helps build one of the most protective molecules in the entire human body. When B6 is deficient, this pathway grinds to a halt. Homocysteine begins to accumulate, quietly damaging arterial walls and setting the stage for cardiovascular disease. This damage prompts the body to patch the injured areas with cholesterol and calcium, leading to plaque formation, narrowing of the arteries, and eventually, impaired blood flow. What's particularly insidious is that this process may unfold over years or even decades with no clear symptoms until a major cardiovascular event occurs. And during all that time, a correctable B6 insufficiency may be playing a hidden role. Despite its importance, B6 is consistently overshadowed by its more famous counterparts in the methylation cycle. B12 gets the lion's share of attention due to its role in nerve health and the dramatic effects of its deficiency. Folate, especially in the context of pregnancy and MTHFR gene variants, has also become a household name. But B6's contribution is rarely emphasized in clinical discussions or public health messaging, even though it is just as indispensable in keeping homocysteine in balance. This is a serious oversight because if B6 is missing, the homocysteine clearing process stalls even if B12 and folate are adequate. The system is interdependent. You can't build a bridge with just two supports. All three B vitamins must be present and functional for homocysteine metabolism to run smoothly. And while B12 and folate are involved in the remethylation pathway that converts homocysteine back into methionine, B6 is the only one that operates the transsulfuration route, the pathway that shunts homocysteine toward antioxidant production. Ignoring B6 in this equation means losing the opportunity to turn a potentially harmful byproduct into a protective compound. Beyond cardiovascular implications, elevated homocysteine has also been linked to neurodegeneration, cognitive decline, infertility, pregnancy complications, and even bone fragility. This makes B6 status not only a concern for heart health, but for aging and systemic resilience as a whole. And yet, very few people, clinicians included, routinely assess or supplement B6 when homocysteine levels are high. The focus tends to be narrow, often limited to folic acid and cyanocobalamin, the least bioavailable forms of folate and B12, respectively, while B6 is left out entirely or included in doses too low or inactive to be effective. This problem is worsened by the fact that B6 can be functionally deficient even when serum levels appear normal. Chronic inflammation, liver dysfunction, genetic polymorphisms, and long-term use of certain medications can all impair the conversion of B6 into its active PLP form. Without PLP, the enzymes that break down homocysteine simply don't work. That's why using the active form of B6, P5P, can be crucial in patients with stubbornly high homocysteine levels or chronic conditions linked to oxidative stress. Meanwhile, public health campaigns about heart health continue to focus on cholesterol, blood pressure, and smoking, important factors, but far from the whole picture. Nutritional methylation status is almost never mentioned, even though it's tightly linked to the vascular system's ability to heal, detoxify, and protect itself. This blind spot ensures that many people, especially those with subclinical deficiencies, remain at risk for preventable disease. In summary, vitamin B6 is not just a supporting player in homocysteine regulation, It is an essential regulator in its own right. Without it, the body loses a primary route of detoxifying this harmful amino acid and misses the chance to produce glutathione in the process. Yet, because B6 is less dramatic, less marketed, and less understood, it remains on the margins of cardiovascular and longevity strategies. It's time to correct that. If we are serious about reducing heart disease, improving cognitive longevity, and lowering systemic inflammation, B6 must be brought back into the conversation, not as an optional add-on but as a critical foundation.